Hello and welcome to Good Life, the health show with me, 𝗟𝗓𝗙𝗘. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. And joining us today is Dr. Deep Ghosh, who is a specialist in orthopedic and spinal surgery at Apollo Hospital in Guwahati. And with an experience spanning up to 20 years in this field and a record of 8,000 plus surgeries, Dr. Deep Ghosh specializes in slip disc arthritis, scoliosis, back and neck pain, spine surgery, joint or knee replacement surgery, and osteoporosis, among others. Well, welcome to the show, Doctor. So, Doctor, can you initially brief us about what is spinal deformity? What are spinal deformities?
Thank you for the introduction. So, basically, what is a spinal deformity? The spine has a normal curvature. It is a normal curvature, and from outside it seems to be straight. If it is not straight, sometimes it may be visible to naked eyes, sometimes it may be visible only on X-ray. That is a spinal deformity.
Okay, when we talk about spinal deformity, how is it different from male and female?
It is said that females are more prone to have these spinal deformities. There are certain genetic makeup, and they have more of weaknesses in the bone, so they are more prone to have these deformities.
So you mean to say, as compared to male, females most commonly undergoes through spinal deformity?
No, not always, but they are more prone to have it.
Okay. So when we are talking about spinal deformity, can you tell us the common types or the conditions of spinal deformity?
See, first and foremost is spinal deformity if the spine is bending forwards. That is known as kyphosis. That happens in old age, but rarely it can happen in the younger age or after infection. Another type of deformity is when the spine bends sideways towards your left or towards your right. That is known as scoliosis. The other deformities, that is known as listhesis, etc., they are rare, but of them, the focus should be on scoliosis, because that is a very unrecognized pattern, especially in the first 2 decades of life. You can have spinal deformities all throughout, but it's the first 2 decades that has the most problematic type of deformities.
So can you mention us about the types of spinal deformities by the names?
See, first one is this scoliosis, and there are various subtypes of scoliosis. Second is the kyphosis, and third is spondylolisthesis. These are the basic broad categories. Now, if you see scoliosis, it can occur at any age, but the most common scoliosis and most relevant deformity is scoliosis in the first 2 decades of life. And in the first 2 decades of life, there are 3 types of this scoliosis. One is congenital scoliosis. That means your spine has some deformity when the person is born, is inside the mother's womb. That is a congenital scoliosis. One is a neuromuscular scoliosis. Sometimes it is associated with strokes, paralysis, and cerebral palsy, etc. This is known as neuromuscular scoliosis. And the third variety that is very underlooked and very common still is the idiopathic scoliosis, the scoliosis where there is no apparent cause. There are certain causes, there are hidden causes, but there are no overtly apparent causes.
Okay, these are the types of spinal deformities. So what are the other spinal conditions?
There are other spinal conditions. Spine is a very vast area, so you can have fractures, you can have anything. But of the deformities, it is, I think, the most relevant is scoliosis.
Okay, so doctor, you have been into this field for around a span of 20 years. So do you feel as the years have passed by, the numbers of spinal deformities have grown so far?
Actually, it's kind of a, you can say, spinal deformities have not grown over the age, but our ability to detect them has grown. If you see in 2002, one study was done from Assam itself, Guwahati.
So doctor, we have a call incoming in this regard.
Yes.
So, hello.
Hello.
Hi. Apuni ki khudibor bicharise?
Acha, মই শ্বটো চাই আছিলো তো স্পাইনাল মই মানে বেক পেইন মানে অকালৰ ফালে এইটো মানে কেতিয়াবা এনেকুৱা পেইন হয় কি মানে উঠিব নোৱাৰো বা এনেকুৱা হয় সেইটো একচুৱেলি কি হয় কাৰণে স্পাইনেল কৰ্ডৰ প্ৰব্লেম নে এনে কিবা বেলেগ কিবা
চাওক প্ৰথমেতো আপোনাক ক্লিনিকেলি চাব লাগিব হ'ব পাৰে আপোনাৰ মানে স্পাইন যোনটো ৰাজহাড় আছে শুড আই স্পিক ইন আছামিজ অৰ ইংলিছ
Sure, Assamese.
যদি আপোনাৰ ৰাজহাড়ত কিবা প্ৰব্লেম আছে বা মষ্ট কমনলি পোৱা যায় ৰাজহাড়ৰ মাজত কুচনৰ নিচিনা ডিস্ক থাকে সেই ডিস্কটো নিজৰ ঠাইৰ পৰা ওলাই পেলাই গুচি যায় গুচি পেলাই সেই নাৰ্ভ থাকে নাৰ্ভত চেপা মাৰি ধৰে তেতিয়া আপোনাৰ মেইনলি পেইনটো হয় সেইটো মষ্ট কমন টাইপ অফ বেক পেইন আৰু বেলেগ কাৰণ হ'ব পাৰে আপোনাৰ যদি বোনছকেইটা উইক আছে বা কিবা আৰ্থ্ৰাইটিছ টাইপ আছে যেনেকুৱা এনকাইলজিছ স্পণ্ডিলাইটিছ তেতিয়া আপোনাৰ বেক পেইন হ'ব পাৰে তো এইটো এটা ভাষ্ট এটা মানে কাৰণ হ'ব পাৰে সেইকাৰণে এটা স্পেচিফিক কাৰণ আমি ক'ব নোৱাৰোঁ তেওঁ আহি ক্লিনিকেলি দেখুৱাব লাগিব কোনোবা ডাক্তৰক তেতিয়া ভালকৈ গম পোৱা যাব
Hi. So proceeding on to the next question. So we were on this question like, do you see any difference in the span of 20 years?
See, what I was talking, there was a study done in 2002 for scoliosis from Guwahati, Assam, in schools in Assam. So the relevance, the prevalence, that means the number of scoliosis in school children was 0.2%. So that means 2 cases in 1,000 students. If you see worldwide, it is around 2 to 4% because they have more of the school screening program, they are more active, they have a public health program that is entirely funded by the government. So they are able to access the healthcare rapidly, more usually than we can do. So I don't think that there is the prevalence has increased. Rather, our ways of screening them and so we are getting more cases that way.
Okay, so can you tell us about the causes of the spinal deformations?
See, one of the causes of spinal deformity is that there is a congenital. That means this deformity, some kind of bone vertebra that is deformed has taken place.
Doctor, we'll get back to this question. We have another call coming in. Hello.
হেল্ল'
Hi, apuni ki khudhibo bicharise?
মই যোৱাবাৰ কি হৈছিলে আপোনাৰ স্লিপ হৈছিলে হৈ পেলাই মোৰ অপাৰেশ্যন হৈছিলে হ'লে তাৰমানে এতিয়া কি হয় আপোনাৰ মাজে মাজে আপোনাৰ ধৰক ৰাতিপুৱা মই বিচনাৰ পৰা উঠিলে তাৰমানে কঁকালটো এইটো হালিব নোৱাৰে তাৰমানে খুব বিষায় আৰু অলপমান খোজ চোজ কঢ়াৰ পিছত বা এডজাষ্ট হয় তেতিয়া কিন্তু ৰাতিপুৱা উঠাৰ লগে লগে বৰ দিগদাৰ পাওঁ এইটো কিহৰ কাৰণে হেৰি হৈছে আৰু কেনেকে ভাল হ'ব ধৰক এইটো মইতো যিখিনি আপোনাৰ এক্সাৰচাইজ দি আছে সেইখিনি মই কৰি আছো কিন্তু সেইটো আৰু ঠাণ্ডা পালে বেছি হয়
আপোনাৰ অপাৰেশ্যন যেতিয়া হৈছিল তেতিয়া কিবা প্লেট স্ক্ৰু লগাইছিলে নেকি
কি ক'লে
কিবা প্লেট স্ক্ৰু লগাইছিলে নে জাষ্ট অপাৰেশ্যন স্পাইনৰ অপাৰেশ্যন হৈছিল
নাই লগোৱা নাছিলে
লগোৱা হৈছিল লগোৱা নাছিলে চাওক এইটো হ'ব পাৰে কেতিয়াবা আপোনাৰ স্পাইনত যোনটো ঠাইত অপাৰেশ্যন কৰিছে সেইটো অপাৰেশ্যন বা তাৰ মানে তাৰ ওপৰীয়া ঠাইত বা তলৰ ঠাইত কিবা প্ৰব্লেম আহিব পাৰে ডেট মিনছ এডজাষ্টেণ্ট লেভেল প্ৰব্লেম সেনেকুৱা হ'ব পাৰে এইটো চাব লাগিব আকৌ এবাৰ আপোনাৰ এক্সৰে কৰিব লাগিব কিছুমান ব্লাড টেষ্ট কৰিব লাগিব কেতিয়াবা মানে ইনফেকশ্যন থাকিব পাৰে এটা ক্ৰনিক ইনফেকশ্যন হ'ব পাৰে সেনেকুৱা আপোনাৰ পেইন থাকি যাব পাৰে ঠিক আছে বা কেতিয়াবা আপোনাক আকৌ মানে কিবা বেলেগ প্ৰব্লেম হ'ব পাৰে যেনেকুৱা ইউৰিক এচিড বাঢ়িব পাৰে বা বেলেগ এটা কাৰণৰ কাৰণে পেইন হ'ব পাৰে সেইটো আপুনি চালি চাব লাগিব আপুনি আপোনাৰ ডাক্তৰৰ তাত য'ত অপাৰেশ্যন হৈছে আকৌ এবাৰ যাওক বা বেলেগ এজন ডাক্তৰৰ তাত আহিব পাৰে
All right. So coming back to the questions, we were talking about the causes of spinal deformity.
So one is congenital. That is, it is the deformity has taken the deformed vertebra or the spine has developed inside the womb itself. So that's one. Number 2 is the the neuromuscular. Say somebody has a stroke or some cerebral palsy, etc. So one half of the body muscles are more stronger than the other part. So this imbalance causes the spine to bend to the other side, and this causes this deformity. So, and third is idiopathic. That's there's no such cause that can be seen. Is very you can identify the cause in an easy manner. There can be if you do genetic studies, etc. You could find out the cause, but there's no specific cause for that. So that's the idiopathic, and that's the most relevant part, and that's the part why I am here. That's the part which is very neglected because
Okay.
When I last asked here for this interview, and spinal deformity, nobody knew it. But if you see, it's the 2 to 4%. And if you see all the other spinal, there are other things like osteoporosis, etc., they cause spinal deformity.
Okay, doctor, we have third call coming in. So, hello.
Hello.
Hi. Apuni doctor ki prashna khudhibo bicharise?
More spondylosis tar karone etu operation koribo korone nore garone.
Prashnoto aro ebar khudhibo.
Apunar ki scoliosis hoise?
More spondylosis ase je etu neck caribulate dingit.
I'm not getting the question.
Apuni prashnoto aro ebar khudhibo niki?
Oh. Etu more mane etu dingit etu 5-6 channel buli koy. Tat etu mane thoru hoise aro etu tar surgery koribo paribo nore etu mane hoi ase.
Na 5-6 ki horu hoise? Gap to horu hoise?
tat mane disc block hoise boli koi ase etu MRI korisilu.
Disc prolapse hoise. Sir, apunar ki hoise? Apnar cervical spine, jonto dingy spine, tat এটা হাড়ৰ মাজৰ এটা হাড় যে কুশন থাকে, ডেস্ক থাকে 5 আৰু 6, সেই কুশনটো মানে নিজৰ ঠাইৰ পৰা ওলাই পেলাই পাছফালে গুচি গৈছে। পাছফালে আপোনাৰ নাৰ্ভ আছে, নাৰ্ভৰ হিট কৰি আছে, সেইটো কাৰণে আপোনাৰ বিষটো হৈ আছে। এটা চাওক, আমাৰ মেইন কথা থাকে, যদি আপোনাৰ কিবা ভৰি কমজৰি নাই বা হাতত কমজৰি নাই, তেনেহ'লে ট্ৰিটমেণ্টটো মেইনলি হৈছে নন অপাৰেটিভ কনজাৰভেটিভ। যদি আপোনাৰ বিষটো অত্যাধিক বেছি বা হাত ভৰি কমজৰি পৰি গৈছে বা পেচাব পায়খানা প্ৰব্লেম হৈছে বা নৰ্মেল ট্ৰিটমেণ্ট কৰি পেলাই আপুনি আৰাম পোৱা নাই, তেতিয়াহে চাৰ্জাৰী কৰা হয়। চাৰ্জাৰী লাষ্ট ৰিজৰ্ট হয়, প্ৰথম ট্ৰিটমেণ্ট নন অপাৰেটিভ হয়।
আপুনি ক'ত লগ পাম মই?
আপোনাৰ তাতে যদি ট্ৰিটমেণ্টত যাব পাৰে,
ট্ৰিটমেণ্টত মোৰ তাত আহিব পাৰে। মই এপ'লো ইণ্টাৰনেশ্যনেল হস্পিটেলত থাকোঁ, আপুনি মোক লগ ধৰিব পাৰে তাত।
ইণ্টাৰনেশ্যনেল হস্পিটেল, খ্ৰীষ্টিয়ান বস্তি।
খ্ৰীষ্টিয়ান বস্তি।
ওকে। কোন হস্পিটেল বুলি ক'লে?
আপুনি খ্ৰীষ্টিয়ান বস্তিত ইণ্টাৰনেশ্যনেল এপ'লো ইণ্টাৰনেশ্যনেল হস্পিটেল তেখেতক পাব।
আচ্ছা আচ্ছা। ইণ্টাৰনেশ্যনেল এপ'লো খ্ৰীষ্টিয়ান।
Okay, thank you so much. So we'll quickly take a commercial break right away and proceed to on more coming questions on this big topic today. Welcome back to the show, viewers, and we are continuing with the topics of spinal deformity, and we have with us Dr. Deep Ghosh. Well, continuing with the questions, can you tell us at what age usually this spinal deformity occurs?
The most common form of spinal deformity, that is the adolescent idiopathic scoliosis, occurs when a girl or a boy turns into puberty. So it's the age between 11 to 14 years, they are more prone to have this deformity. You can have other outliers in the young age or even after 20, but this is the time when they have this deformity. It happens that way because the spine grows at the maximum speed at that time. You will see during this puberty, the person grows in height, increases his girth, and increases weight. So that's the time when the spine grows rapidly. That's the time you have more of these deformities.
So you mean to say that children's at the age of adolescence suffer more of this spinal deformity,
because they are
which is
growing
called
at
scoliosis. Okay.
Mainly scoliosis happens at that time.
So scoliosis, like I have been through some research that scoliosis happens to be a hereditary one. Is it true?
Actually, it is not like a plainly straight hereditary that your mother has or father has a scoliosis, so you will have it. It's called incomplete penetrance. That is that might be your grandfather could have it and you could have it. Might be your 2 siblings, 3 siblings, 2 could have it, the third one could be safe. Might be one of the siblings could have very minimal scoliosis, just noticeable on X-ray. Other one could have a very large deformity. So these are variabilities there, but sometimes around 30 to 40%, if we see among the close relatives, they have some scoliosis, some deformities there. some may be very high, some may be less. So, that way it shows that it is a hereditary, but we do not know the specific genes, or there is no specific one gene that can cause it, multiple genes, and they are associated with environmental factors, etc., that can interact together.
Okay, so one who suffers this spinal deformity, what are the treatments they can go through? Some are operative, some are non-operative treatments. So if you could explain our viewers about that.
Actually, first is the detection, and that is the part which we lag, because see, the females at that time, now they wear the more at the time of puberty, as our culture is, they will wear the full clothes. So even the mother will not be able to appreciate. Sometimes the teacher will appreciate that there is a deformity. So that goes one. Second thing is to go to the relevant person. Like I am a trained in scoliosis, so I know the ins and out, what can be done. So not all doctors can treat this, and not all doctors are equipped to handle such cases. So they should go to specialist. Thirdly is that before anything, before surgery, first is the the diagnosis. How much is the curve? What is the type of curve? Is there any associated other abnormalities in the spine, etc., or anywhere in the body itself? So these things are set, and generally, if the curve is less than 30-40 degrees, it is non-operative. If it goes beyond that, it is surgical. So that's a broad, very broad mark to separate, but it kind of works like that.
So since we have talked about the treatments both operative and non-operative, so can you tell our viewers about the cost range? Can people afford, some people who are financially backward, can they afford those treatments?
Yes, the cost is a very big factor, and not everyone requires surgery. And there are few who require surgery, the cost is a bit high. We try to help our patients, but in other parts there are NGOs, there are charitable organizations who help it, but we have found it lacking in our part. Still we are trying to do. So the cost in Apollo Hospital could range from 5 to 6 lakh rupees.
What schemes or options are available for someone who is financially backward and needs to go through some crucial treatment for this?
We try to talk with the implant companies and try to reduce. We try to talk with the hospital, but that is where we are lacking in our part, and perhaps that is why I have come to you in this channel to discuss about this problem.
So me being in a field, in a corporate field, and so I have seen a lot of people of our age going through spondylitis. So what are the measures they can do to prevent such problems?
See, first and foremost is that this corporate life is not healthy. The long work hours, the lack of exposure to natural sunlight, the diet that is not very conducive to the health that we are. But since life being life, this is the modern times, we have to adjust ourselves within it. So first and foremost, sleep, rest, normal diet as far as possible. Work hours should be as less as possible, whatever possible. You should not be a workaholic. Second thing is that when you use your computer screen, etc., you should place your neck in such a manner that you don't look down too much. So it should be just at the level of your eyes or just below it. You can have a comfortable chair with a backrest, proper backrest, and that depends upon your height. Okay. You can adjust your height, etc., and take it that way comfortable. And lastly is that you should not constantly sit on the chair for more than 1 hour. If you are doing that, you have to do just walk about and just stretch yourself. And when standing, not more than 1 hour at a time. So these are the few things we can.
So I've seen a lot of people, they go through this neck belts and exercise. Are these belts and exercises much effective?
Yes, it could be. Means it depends on case to case. So there is no single answer that belt will be effective in every case. In certain cases, yes, belts do help. We give it in places where we have the acute exacerbation of the neck pain. We give it that way, but we advise them to not to take it continually, because because we want to strengthen our neck muscles, and that's the best way to do it. That preserves your integrity of the neck, spine, etc. And if you constantly wear your belt, your neck muscles will stop working, and now you will be dependent on the belt. So, we do give it for 5 to 7 days. So, it is best to be taken under a doctor's supervision or a physiotherapist supervision.
So, we have learned about the types of spinal deformity, what causes it, and we also have learned about these operations or the treatments one can undergo. So, can you tell us how can one prevent from facing such a big problem in the life?
Yes, and another thing I will just, sure. One is this, what are the non-operative treatment, then I will go to. So, the non-operative treatment also plays a big role in scoliosis, but one should know that this non-operative treatment does not prevent the progression of the scoliosis. It can halt, and so that it can get to a manageable age or something. There are belts, there are exercises. Now, belts, the problem in India is that if we wear the belts, because of hot environment, we cannot wear it for long hours. So, basically it is told that the belts have to be worn for around 20 to 23 hours in a day, and that is very cumbersome in our country, in our place in Assam, because of high humidity. Other places in Northeast being the same. When I face the patients and their parents that you have given belt, now still the scoliosis is increased. So, scoliosis does not correct, means this belt does not correct the scoliosis, rather it controls. So, if it is 40 degrees, it will be around 40 to 43, 44. So, during the growth, it will just maintain the belt. There are exercises also that can help. Regarding your question, what is the preventive measure? See, perhaps prevention is better than cure. So, first is detection. And because we come from a very poor area, you know, that we have seen people, patients of scoliosis from the rural areas are not very, they are not very resourceful. So, there was very small scoliosis, and this was a time when belt would have done very well, but they have not taken the treatment, and range is now somewhere around 100 degrees, 120 degrees, and it's very difficult to do surgeries, and very costly, immensely costly, and these are very risky surgeries also. Scoliosis is in high grade scoliosis is very, very risky, but still we were able to do it, and very costly too. But that is the place. Perhaps prevention, one is first is detection. There are school screening programs elsewhere like in Singapore, in USA. So, there are teams of nurses that go into the schools, and they pick up those students that are vulnerable to have the spinal deformities. Now, once they are picked up, now they are checked by an expert, scoliosis expert, and then they are followed up. So, in this way, this is a prevention, and per se the prevention we cannot do, we cannot change something in the hereditary pattern, you cannot change something in the mother's womb, etc. This is the part we can intervene.
So, doctor, we are running short of time right now. So, lastly, the viewers who are watching this show right now, what would you like to send them a message right now?
See, know about scoliosis is not that uncommon, 2 to 4%, and even in our state, it has been found to be 0.2% with a female 2:1 male ratio. And so, it is very common. So, know that there is a deformity, there is a disease, this is common. If you have something like this, don't get scared, come to the right person, do a proper treatment, and treatment is now available in our place also.
Well, all right, that's all we have in this episode of Good Life, the Health Show. Thank you so much, Dr. Deep Ghosh, for coming here and joining us and telling our viewers about this big topic of spinal deformity that we face, the population faces today. Thank you so much. Keep watching Northeast Live, and thank you for watching.
Thank you.